We are the Warfighter Deployed Medical Systems Project Management Office. Deployed medical systems is one of the final steps in the acquisition process. So we procure, field, and deliver the things that come out of decision gate, out of the milestone process. So without this PMO, we execute all the procurement dollars, so nothing would be procured and nothing would be fielded to the warfighter. What I like most about my job is we interact directly with the users that use our devices. We get feedback almost daily on ventilators, on vital signs monitors. So whenever there's an issue with maintaining it or using it or training on it, we get phone calls directly from the field. So it's daily interaction with the folks actually using the devices. One of the other things that we bring to the table that I've really enjoyed having is we have clinicians, actually active duty Army clinicians, that rotate through our team every 2 or 3 years. We have a nurse consultant, we have a lab consultant, we have a pharmacy consultant, and these folks bring incredible expertise. Many of them have been deployed or even just recently came off a deployment. So it is an excellent resource for the rest of my team who maybe had never been deployed and doesn't understand fully how that device will be used in a deployed environment. So having that expertise on our team and provide that support to the IPTs has been extremely valuable. We're divided into 2 groups right now. I have one team that focuses directly on the things that are already out there. We manage 207 line item numbered equipment that's currently deployed. They're fielded in 140 different sets, kits, and outfits. And so the Medical Device Assemblage Management Product Management Office manages those day-to-day activities. So if there's a maintenance issue with one of those pieces of equipment, if a unit needs a specific item to fill out its sets, those are the folks that do that analysis and do that procurement. Of those 207 items, there's roughly 30 that are no longer procurable right now. So I have a modernization product management office, and their focus is modernizing the equipment. So the suction apparatus was one of the recent successes. Company no longer made it, so we had to source a new solution and then get that fielded along with all the equipment that supports it. And then the modernization team manages the major force design updates like the combat support hospital conversion. They have a team within there that's focused solely on doing that for the force. So between the day-to-day activities and then the modernization and the future activities, those 2 groups help us get the right product to the right warfighter at the right time. As Army has moved and developed, they stood up what's called the Army Futures Command. It's one of the biggest changes Army's underwent in the last several decades. As part of that move, Army Medical was affected, and there was a division between the agency I used to be at, U.S. Army Medical Materiel Agency, which has now moved to the Army Materiel Command to focus on the sustainment of the medical equipment. My team, our focus was not sustainment, it was more on the upfront procurement and fielding, so we moved to be more joined with the acquisition folks that are here at USAMDA. So it was actually a great move for our team. We're more closely intertwined with the people doing the development. It's, I think, a better alignment of our mission space, allows us to work with the other project management offices to meet our shared objectives. At the same time, we remain a very close link with USAMA to make sure that the sustainment of those items occurs when it needs to after we field the item. So. The team is what makes me the most proud. The way that they're just excited to come to work and work on their devices because they know that what they do on any given day has a direct impact on the warfighter. And so that has a certain amount of energy and passion that goes with it that just makes you want to show up to work in the morning. It's very exciting to work with those people.